Good morning. Today's topic is tissue repair. Let's discuss in detail about the topic. Okay, what is meant by tissue repair? Repair is also known as healing. It is nothing but restoration of the tissue architecture and function after an injury. So it is often used interchangeably by two terms, which is called as repair and healing. The term repair is used for parenchymal and connective tissue, whereas healing is used for surface epithelium. However, these two terms are used interchangeably. So generally the repair occurs by two types of reaction, which can either be regeneration by proliferation of residual cells and maturation of tissue stem cells, or by deposition of connective tissue, which is otherwise known as scar. These tissue stem cells are nothing but they have the totipotency capacity. That is, they can give rise to enormous number of cells. They can differentiate into various number of cells which is present in the body. So now we are going to see about regeneration. What is this? This picture? It is nothing but lizard. Some species of lizard have the capacity to regenerate whatever the organ which is lost. For example, if they lost the tail or leg or head, they have the capacity to regenerate. So, some tissues are able to replace the damaged components and essentially return to a normal state. For example, surface epithelium of skin and intestine, liver. So, what occurs if the regeneration is a failure? That is, if the injured tissues are incapable of complete restitution or if the tissues is damaged beyond repair, then it results in scar formation. Scar formation provides a structural stability for function, but it cannot completely resuscitate the tissue which is lost. It just provides the structural stability. See, this is the normal epithelium. This is the surface epithelium, which is nothing but the cuboidal epithelium. And see the mesenchyme, underlying epithelium. If there is a mild superficial injury, then the tissues can be able to regenerate and it restores to a normal state. While if the injury is severe and if it is beyond repair, then it results in connective tissue deposition, which is otherwise called as scar formation. This is the two pathway by which the repair occurs. Cell and tissue regeneration. What are the requirements for the regeneration? First is the proliferative capacity of the cell, then the growth factors for the proliferative capacity, which are the growth factors forms the essential component for the proliferative capacity of each cell, and the integrity of the extracellular matrix, then development of mature cells from the stem cells. So these are all the requirements. Depending upon the potential of cell renewal, three types of cells are present. So they are broadly classified into labile cells, stable cells, and permanent cells. What is labile cells? They regenerate regularly, which includes surface epithelial cells, surface epithelium of GIT and skin, hematopoietic cells in bone marrow. What is stable cells? They are nothing but they can regenerate, but they will regenerate slowly. They will divide whenever it is necessary. For example, liver, kidney, and pancreas. Permanent cells, they don't have any regenerative capacity. Hence, there is no effective regeneration. For example, neural cells of CNS, cardiac muscle. Once there is no effective regeneration, what is the mode of repair for the permanent cells? They are nothing but scar formation. For example, since it includes cardiac muscle, can you say the scar formation in myocardium, what it leads to? It is nothing but myocardial infarction. They heal by, once there is myocardial infarction, they heal by scarring. So if there is a tissue injury, if the tissue injury is total, then it results in scar formation. If the tissue injury is partial, then depending upon the type of cells in which the tissue injury occurs, the mode of repair also differs. For example, in labile cells, it regenerates. In stable cells, it regenerate or it may lead to scar formation. In case of permanent cells where there is no effective regeneration, it results in scar formation. Now we are going to see about liver regeneration. See what is the picture you are seeing here? He is nothing but the Prometheus. He was punished by Zeus for stealing the power of fire. And this is the eagle. Zeus punished Prometheus through eagle. This eagle used to eat the liver of this person day by day. Even though it eats the liver grows, which means, in other terms, it means regenerates. Though it is a myth, it was actually proven later. Thus, the liver regeneration takes place by two major mechanisms. One is by proliferation of remaining hepatocytes. The second is by repopulation from the progenitor cells, that is nothing but the oval cells or the tissue stem cells from which the liver cells proliferate. So the proliferation of, first we will see the proliferation of the remaining hepatocytes. It takes place in three phases. One is priming, second is proliferation, and third is termination. What happens in priming phase? This cytokines like TNF alpha, interleukin 6, which is produced by the Kupffer cells, will prime the remaining hepatocytes, so that which will be further activated by the growth factors in the proliferation phase, and it leads to replication of the hepatocytes. Once the hepatocytes have been replicated, the other stable cells like stellate cells, endothelial cells will undergo replication. So once the replication has been complete, what happens? The TGF beta will come into play. Thus, it remodels the extracellular matrix and stop the proliferation. So, these are all the three phases of proliferation of remaining hepatocytes, which includes priming, proliferation, and finally termination. Then liver regeneration from the progenitor cells. The proliferative capacity of hepatocytes, or if the proliferative capacity is impaired, the progenitor cells like oval cells, which resides in specialized nikes like canal of Herling, will regenerate. Okay. If that regeneration fails, then what happens? Then the next repair occurs, that is repair by connective tissue deposition. This repair by connective tissue deposition occurs if there is either damage to permanent cells, or there is severe destruction of the connective tissue framework, or if there is extensive cell injury, or in case of chronic inflammation. In contrast to regeneration, scar formation is nothing but a response which patches rather than restores the tissue. As I said before, scar formation helps in maintaining the structural integrity, but it doesn't replace the normal tissue. So, what are all the steps in scar formation? These are the three primary steps which are involved in scar formation, which includes angiogenesis, formation of granulation tissue, and remodeling of connective tissue. What is angiogenesis? Formation of new blood vessels. Formation of granulation tissue derives its term by pink, soft, and granular cross appearance. They are nothing but granulation tissue are nothing but it is characterized by proliferation of fibroblast with thin new walled capillaries in a loose extracellular matrix which is admixed with inflammatory cells, mainly macrophages. Then comes the remodeling of connective tissue, which produce the stable fibrous scar. While learning granulation tissue, you must make a clear distinction between the granulation tissue and granuloma, because students always mistake and confuse between the granuloma and granulation tissue because of the close resemblance of the name. Granulation tissue is nothing but there will be proliferation of fibroblast along with new thin-walled capillaries, whereas granuloma is nothing but formation of activated macrophages along with giant cells with or without central necrosis. Then peripheral lymphocyte puffing. Okay, this is the difference between the granulation tissue and granuloma. So, what are the steps in repair, which is by scar formation? This is the normal. This is the normal tissue. Once there is a area of injury, there will be inflammation, and the inflammatory cells will comes into play, followed by which the migration of the, see here the inflammatory cells have come into play. This is the macrophages and this is the neutrophils. The macrophages plays an important role in the clearance of the debris. After that, which there is formation of granulation tissue, as I have said before. It's composed of macrophages proliferating fibroblast, then newly thin wall capillaries. See, finally, collagen synthesis, then scar formation, after in which there will be remodeling of the fibrous tissue. This is the histology picture of the granulation tissue. These are nothing but the thin walled capillaries. Behind that are the proliferating fibroblast along with the chronic inflammatory cell infiltrate. So now we are going to discuss in detail about angiogenesis. Angiogenesis is nothing but formation of blood vessels, new blood vessels from existing blood vessels. It can be either from endothelial precursor cells in bone marrow or from pre-existing vessels. So this is the stages in which the angiogenesis proliferation occurs. See, first vasodilation occurs in response to nitric oxide and increased vascular permeability in response to VEGF, that is vascular endothelial growth factor. So this is the quiescent vessel which on angiogenic factors like angiogenic factors, there will be vasodilation in response to nitric acid and increased permeability in response to VEGF, followed by which the pericytes will get detached or get separated, followed by basement membrane degradation. Once the basement membrane have been degraded, there will be elongation of the vascular stalk, by which means of endothelial cells proliferate along the leading tip of the migrating cells. Then further which there will be remodeling of the capillary tubes. Once there is remodeling of the capillary tubes, then the pericytes will be deposited, followed by which the basement membrane deposition. Once there is a formation of a complete new blood vessel, then there will be suppression of the endothelial proliferation and migration along with deposition of basement membrane. What are the growth factors which is involved in angiogenesis? Formation of new vessels by vascular endothelial growth factor and fibroblast growth factor 2. Stability of new vessels by angiopoietin 1 and 2, which is involved in the stability of perioendothelial cells, and platelet derived growth factor plays an important role in stability of smooth muscle cells, and transforming growth factor beta plays an important role in ANCM protein secretion, as well as it suppresses endothelial proliferation and migration. When it suppresses endothelial proliferation and migration, once the remodeling has been done and it is supposed to stop the proliferation and migration, TGF beta comes into play. So not signaling through crosstalk with the vascular endothelial growth factor, it regulates the sprouting and branching of new vessels to supply the healing tissue. So not signaling also plays an important role in angiogenesis. Deposition of connective tissue. Now comes the final step. It generally occurs in two steps, either by migration and proliferation of fibroblast into the site of injury, or by deposition of the extracellular matrix proteins produced by these cells. So first we will see about the migration and proliferation of the fibroblast. So macrophages, platelets and endothelium plays an important role in fibroblast migration. So these cells will stimulate and enhance the production of the growth factors as well as the cytokines. The growth factors which are produced by these cells are TGF beta, PDGF and FGF, and cytokines like TNF, alpha and IL-1, which in turn leads to fibroblast migration and proliferation. So TGF beta, as I have said before, it plays an important role in fibroblast proliferation as well as in migration, as well as it has an important role in collagen synthesis, and when it reaches the terminal stage, it plays an important role in the stoppage of proliferation and to return to the normal state. It is also one of the anti-inflammatory cytokine. Thus, it inactivates or suppresses the recruitment of lymphocytes or neutrophils at the inflammatory site. Then extracellular matrix deposition and scar formation. Growth factors mainly platelet-derived growth factor, fibroblast growth factor, transforming growth factor, and cytokines mainly interleukin-1 and interleukin-13 stimulate the fibroblast to produce collagen. Once the collagen is formed, it is dependent upon, since the net collagen is generally dependent upon both the production and degradation. On one side the production will be going on, and one side the degradation will be going on by different factors which are contributing to them. So the net collagen is finally dependent upon the production and degradation. Then final phase of remodeling of connective tissue. Outcome of the repair process is, as I said before, is generally influenced by balance between synthesis and degradation of ECM proteins. So synthesis, we have discussed how many cytokines have been included in synthesis, how many growth factors are involved in synthesis, while the degradation is accomplished by matrix metalloproteinases. They are nothing but the zinc dependent or metal ion dependent proteinases. So the matrix metalloproteinases are produced by fibroblast, macrophages, neutrophils, synovial cells, and some epithelial cells. They are regulated by growth factors and cytokines. So there are a numerous number of matrix metalloproteinases. Here we will discuss the important matrix metalloproteinases. So the MMP 1 and 2, 1, 2 and 3, which is otherwise called as interstitial collagenases, cleave the fibrillar collagen, while the MMP 2 and 9, which is otherwise known as gelatinases, degrade the amorphous collagen and fibronectin. Matrix metalloproteinases 3, 10, and 11, which is otherwise called as stromal lysin, degrade the proteoglycans, laminin, fibronectin, and amorphous collagen. Generally, these matrix metalloproteinases are produced as inactive precursors in the form of zymogens. This is further activated by the proteases like plasmin, which are likely to be present at the site of injury. So these metalloproteinases are inhibited by tissue inhibitors of metalloproteinases. Thus, during scar formation, MMPs are activated to remodel the deposited ECM, and their activity will be shut down by tissue inhibitors of metalloproteinases. Thus, in summary, the repair is mediated, that is the final, it can either be occurs by regeneration or by scar formation. The final scar formation is dependent upon the metalloproteinases degradation and the generation. Thus, it is a balance between the generation and the degradation.